Most welcome to my YouTube channel. Uh, I'm really glad to be back. Thank you so much. I'm going to take you through reason for the mother to attend antenatal care. It's really important. Some of you you don't have that much information why a mother is supposed to be attending the antenatal care. It's really important. And once you try to exercise this, it's going to be the brilliant way for your life changing. So once you obtain this information, you can try to share with your colleagues so that they also have to have brilliant information about health, right? It's really important that once you understand something, you share with your friends to maintain healthy vital to everybody. So one of the most important thing is it helps to ensure that women are safe from pregnancy, and this does not mean that maybe uh is in absence of some disease condition that be there, but it helps them to ensure that for them to have a self pregnancy. So it's really important that I have to address this information to the maybe pregnant women, or maybe you are a father, you're having a wife, so they have to have more information about this. That is going to help you on how you can take care of your wife, or how the wife herself can take care of herself. It's really important. So you gonna have to understand that and master that. It's so important. And at the same time, on other hand, it also helps in screening for pre-eclampsia, whereby maybe there'll be some maybe complications that maybe will cause some pains maybe during the period of pregnancy. So once she is attending antenatal care, she's going to have more information about how she can take care and how to break some of the barriers to the pregnant that maybe can harm her. So it's so important and very essential to the women to have that understanding that they have to be attending the antenatal care for. This is also going to help to prevent some abdominal or fetal abnormality, whereby maybe abnormality, whereby maybe a fetal has to be in a safe environment within the womb of the mother. So while the mother is attending antenatal care, they can screen to check the baby, how the baby is, the positioning of the baby. It help even during childbirth. It's going to help them to they are going to know what type of bath they are going to use. So it's really important they have to ensure that women they have to be attending antenatal care. It's so brilliant. And another point is it helps to follow the definitive plan and the schedule. All right, it's really important. Once these women they are attending the antenatal care, let me tell you, they're going to have a clear plan. They're going to know when is maybe when they are going to give birth, and when they're planning for that, they are planning well because they are attending antenatal care and they know their health status and what's going to happen next. All right, so they get to be aware and they plan well. For example, if maybe a woman don't know, maybe like maybe to next week I'm going to give birth, they can't have that schedule of planning some of the necessities during childbirth. Maybe when maybe the baby is born, some of the naps that maybe is needed for the baby. So you find that maybe they are not even prepared. They are not even they haven't planned. They haven't even scheduled that. They don't even know. So once they are attending antenatal care, they get aware of what is going to be the next. All right. And another thing is it helps to any problem orientation or oriented, whereby they are going to recognize what is a problem, what is the best strategy that we have to use to sort out the problem that they are in. So they are going to understand how they can handle different challenges, because once they are attending antenatal care over there, they get some um, teachings. They share the knowledge with the friends, so they are going to have that clear picture of themselves about the problem that maybe they may face and how they can handle those problems. So it's really important that once they understand this, they're going to be at that position of maintaining their health, right? And another point, it helps to identify the risk factors and prevent the upcoming challenges, right? Challenges that may come, they might be prevented. So once they identify the risk factors that maybe they may cause some harm to their fetus or maybe to their pregnancy, they're going to understand how to take care of themselves and be the vessels of their health. Once they understand, because health is like, once we are able to prevent something, it means once preventing, you can't prevent something without understanding what it is, and you can't prevent something without understanding its strategy risk. So you have to understand how it's coming in and how you can block it, right? So it's really important that once we impart the knowledge to the pregnant women, they go, maybe they attend antenatal care, they're going to have knowledge on how they can take care of themselves, right? They're going to know how to prevent some of the disease. They're going to know how to block the transmittive routes about their health. So they are going to have that clear picture of their health. And another point, it helps to identify the potential complications, things that maybe trigger their health. They're going to understand, right? They're going to identify them to know, okay, this is how it's coming in. They're going, because once they are going there to the hospital, they're getting maybe taught, they share each other knowledge about antenatal care. So once they're having that, they're going to know how to uh, prevent some of the complications, right? And I also earlier said that it helped to screen of health conditions. Maybe some of the challenges, maybe they are going to be identified through screening. Once they are able to screen, they are going to know what challenge maybe the baby is facing, maybe within the womb, because once they are not going there, they can't know the position of the baby that maybe is heading to. And also maybe they can't know either it's going to be breech or maybe it's going to be symphatic. So it's really important that once they are maybe attending the antenatal care, they're going to have that important or maybe brilliant knowledge about their health, which is going to help them to understand how to take care of themselves. So it's really important that they have to be attending antenatal care so that they have all the information about how they can take care of themselves. And once they're attending there, these pregnant women, they're getting they are receiving some there's provision of health education, which is really important. They're going to gain a vast knowledge about um, uh, their health. They're going to understand how to take care of themselves, right? So it's really important that these pregnant women, they have to be attending antenatal care so they have a vast knowledge about how they can take care of themselves and they are living their lives, so that they maintain their health as well as the health of the baby, because health of the mother matters the health of the baby. Once they are in the womb of the mother, whatever mother takes in is going also to be shared to the child. If a mother is smoking, the baby is also going to be receiving the smoke, carbon monoxide, which is going to be damaging the cells of the baby. Hence, it's going to cause the started growth in the baby. The cell, once the cell they're dying off, it means there is no development, because increasing number of the cells is what makes the human to keep on growing, changing the levels from one stage to another stage. All right, so once if maybe there's that obstruction, if they don't have much knowledge that maybe whatever I take is also going to be shared to the baby. If I smoke, the same smoke is going to be transmitted to the baby, and the baby might face some challenges. All right, and at the same time, once they are able to be screened, it means they are going to be able to recognize their health status and how they can take care of themselves, so they have to transmit the disease to the baby. All right, for example, if maybe they are maybe recognized to have maybe HIV and AIDS, or they are recognized to have HIV and AIDS, they're going to know how to take care of themselves so they have not to transmit the HIV to the baby. So Once they're attending antenatal care, all this is where they can source this vast information, how they can take care of themselves. So it's really important they have to be attending antenatal care. It's so important. I'm making it to be an emphasis because the health of the mother determines the health of the baby, and the fathers, they have to put much effort to help mothers to understand why it's so important to attend antenatal care. For some of the fathers, maybe they have vast knowledge about how antenatal care is. Try to approach your wife, explain what it is and the barriers if maybe they are not attending antenatal care and what it can result to. So it's really brilliant that we have to help these pregnant women to understand how to take care of themselves. Right. Furthermore, it helps to make sure that pregnancy causes no harm to the mother, to keep the developing baby healthy, as I earlier said. This is the really important. Once they're attending antenatal care, it means their pregnancy is going to be safe, right? It's going to be safe in the way that it's not going to have more complication. It doesn't mean maybe it's not the absence of the disease. There is some condition maybe they'll be there, but they'll be at least to reduce some. So it's really important they have to be attending antenatal care for their health, determine the baby's health. So the baby can be growing healthy right in the womb of the mother because the mother is able to identify the risk and be able to free from the risk and be able maybe to prevent them, to block the transmittive routes that maybe can cause the baby to be suffering from some of the conditions. So it's really important that they have to impart the babies, the mothers, so they have vast knowledge on how they can take care of themselves so that they maintain the health of the baby safe. This is what I wanted to share with you. Thank you for attending my YouTube channel. I wish to share to see you next time and share you more information about health. That you have to live a rigorous life, a life of your potential, living a life of fully understanding the world and how you can break the transmittive load. Thank you for attending my YouTube channel. Bye bye.